Good morning, Javier. Thank you for joining me today. This is Susie Jana, Healthcare Director, Edison Group. Today we have the Chief Financial Officer of ROVI, Javier López-Belmonte. Welcome, Javier. Thank you for taking the time to speak to me today. ROVI has released an announcement on the impact of COVID-19 on the company's activities. And if I may, I'd like to start with some questions.
Hello, thank you, Susie, for this interview. I'm very happy to answer to your questions.
Great. Firstly, can you talk us through the short-term impact that COVID-19 is having on ROVI's operations, talking about Spain and internationally?
Yeah, for sure, Susie. Let me start saying that we feel very lucky as a company because from a personal standpoint, all of our employees are safe and healthy, even though we have some mild positive cases with coronavirus. Overall, let me start saying that we also believe that we are less impacted than other companies. Firstly, because our sector of activity is clearly less impacted, pharmaceuticals. And second, because of our underlying recurrent business, which I will devote more time in a second, but overall, sales during the first quarter has behaved in line with company's expectations. And as a consequence, I can confirm you right now that the growth forecasted reported previously for 2020, which placed the growth in operating revenues in mid-single digit figures, will be maintained, at least from the time being. Clearly, it's not yet possible to make a precise assessment of the impact that the pandemic will have on the current year. But again, as I said, we confirmed the guidance, even though we expect the main negative impact on the group sales to take place in this second quarter of 2020.
Perhaps you can touch on what your expectations are for sales of your primary products, such as BCAT and Hybor.
Yeah, we have one of our main businesses, as you were mentioning, is our low molecular weight heparin franchise with bemiparin, Hybor, and BCAT, the enoxaparin biosimilar. Sales of both products account for close to 50% of sales of the company in last year. But these drugs are essential medicines for people hospitalized. Even the World Health Organization have recommended the usage of these products for COVID-19 patients who are in intensive care units. And also for this reason, and in view of the habitual use of the product in hospitalized patients, the company believes that there will be a rise in the use of the heparins during the period of the health crisis. However, on the other hand, we expect that a significant reduction in the number of surgical operations performed during this period of confinement worldwide. So likewise, this will affect the division sales. No? So it will be a mix effect, but we are not that worried about the performance of the heparin business.
And what about your manufacturing capabilities? Is there any impact there?
Let me say that we are very proud and very satisfied with the response that our own employees did at the crisis, or is doing at the crisis. Our activities remain at normal capacity at all the plants, although productivity has been somehow impaired by the various preventive measures concerning sanitation and safety, in relation with the COVID-19. But overall, right now, production is on a normal level. We can maintain again the guidance for the total manufacturing operations. We haven't suffered any backorder situations with regards to any supply chain or any good that we need for manufacturing. But however, again, we have to be very cautious at this time. Current situation and potential impacts are really, really unpredictable. We have to assess in a daily basis. And we know that if something happened, let's say in an event of infection of, of a group of employees, our operations could be impacted in the short term. No? However, as you know, most of our operations are in Madrid, and Madrid has already been hit very hard, and apparently we are, let's say, already passing the peak of the infection. So we are optimistic, so that operations will not be impacted.
Okay. Just moving on now, ROVI has filed the MMA for Doria in Europe, and previously the NDA in the US has been expected later this year. Can you give us any idea of an update on timings given the current situation?
Yeah, you are right. No, we have filed Doria risperidone ISM monthly in Europe. Our assumptions were that the normal registration of this kind will take 1 year, so more or less on average 1 year. So that means that approval could be February 2021. However, we are not aware that there will be any kind of delay in the approval process. But we understand that the efforts of the EMA, the European Medicines Agency, are currently very, very focused on coronavirus. And we cannot rule out delays in the approval for our drug, no, under the current circumstances. No? Likewise, for the registration of the medicine, of the drug in the United States, here we depend somehow on third-party assistance, which means that ROVI at this moment, we cannot be certain that our application will be filed later than the data report previously, you know, that was second half of this year. No? Again, we do believe right now that this could of delays are going to be not material, especially when we're talking about R&D, that we've been developing this product for the last 12 years. So maybe a couple of months or 1 quarter of delay, I don't think that there's any material impact.
Lastly, ROVI is a revenue and profit generating pharmaceutical company. Can you discuss the strength of the company's balance sheet and whether you expect the current dividend policy can be maintained?
I think, again, we are very proud of our financial policy that has provided us with very sound balance sheet. No? According to our latest public information, we had net debt of 15.9 million euros at the end of last year. That means a net debt EBITDA ratio of 0.26. If we exclude financial leases, financial liabilities for leases, yeah, we did have a positive cash position, no? Of around 5 million euros at the end of last year. No? I believe if we add to that cash positive position, if we add our cash generating capacity, and we add all these credit lines that we have been able to sign to secure our financial liquidity needs, currently we could say that ROVI has levers to use close to 115 million euros, no? Of cash at hand. No? I think that leaves ROVI in a really, really nice financial situation. No? So we can focus on our operations, and we don't have to spend any single second talking to debtors and banks. No? And having said that, as you were saying, we have a dividend policy approved for this year, which is around 10 million euros of dividends. Again, this has to be approved by the General Shareholder Assembly. Up to now, the financial position of the company is good, and we don't think that we can risk that dividend. No? But anyhow, this crisis is unpredictable. This crisis is unique, unfortunately. So we have to keep being cautious, and we cannot confirm that the dividend will be approved or will be given, no, at this point.
Okay, great. Thank you very much.